Tinnitus is a fancy word for ringing in the ears, and many people have this. It's not always ringing. Sometimes it sounds like a tone or a bell. Sometimes it sounds like a buzz or a hiss or a roaring sound. Many people hear different sounds. The interesting thing about tinnitus is the person who has it is the only person who can hear it. So if you went up and sat next to them, even if you were very, very close, you wouldn't hear it, but they do. That doesn't mean it's in their imagination. It's in their head, but it's absolutely real. Our best understanding is that tinnitus is an abnormal firing, abnormal activity in the brain. And the hearing part of the brain is getting signals from some damage along the pathway that connects the ear to the brain. It's getting signals and it's trying to decide what to do with those signals. So it interprets them the only way it knows how. It says, there's a sound there, when there really, really isn't. These people hear this, and we can take pictures of the brain and actually see the brain light up, just as if it was hearing a real sound, even though no sound is going in the ear. It creates a lot of problems for these people. They can't sleep at night. It makes it hard for them to concentrate. It's hard for them to understand what other people are saying. It makes them very nervous because they're afraid they may have a serious disease. They're afraid it's going to get worse. They're afraid they're going deaf. This is a simulation of what tinnitus sounds like from one of my patients here at the Oregon Health and Sciences University. So I just want you to hear it and listen to it. And this is the sound that this person hears 24 hours a day, 7 days a week. It's not very pleasant for us to listen to, and we can turn it off whenever we want. This poor patient can't turn it off. Right now, we have no cure for tinnitus. There are some medical diseases that we can treat that cause tinnitus, and we can make it go away in those cases. But in many cases, by the time they get here, those diseases have been treated, and the only thing that remains is the ringing. The number one cause of tinnitus is noise exposure, damage to the cochlea, damage to the little sensors in the ear, the hair cells, from noise. So the best way to avoid getting tinnitus is to protect your hearing.